My name is Golnush Sharafsaleh. I'm a geriatrician. We moved to Morganton, North Carolina to be in a smaller town, in a geographically a better place to access the mountains, a larger airport. It just fits what we needed. And we have 2 young children, and we thought this would be a great place for them to grow up. A geriatrician, if you don't know, is a person who takes care of older adults, patients who are 65 and older. We do things a little bit differently. We are primary care physicians to older adults, but we also take care of other needs, like multiple medications. We call that polypharmacy, or cognitive problems like dementia, sometimes Parkinson's disease. You can either do a residency in internal medicine or one in family medicine. And then you do a fellowship for 1 year in geriatric medicine. And sometimes some people do it for 2 years and do a research year as well. So I did an additional year in geriatric medicine. I thought a family medicine residency would be a better route because as a geriatrician, we do things like make house calls. And sometimes our patients need a knee injection, a shoulder injection, and having a family medicine background, I was able to get that type of training. Sometimes patients need a skin biopsy and they're unable to go to a dermatologist, and we're able to do minor procedures like that, either in the office or in a retirement community, like a nursing facility where we have a sterile area we could work and do those procedures in. And that was the reason I picked family medicine. A lot of geriatricians actually make house calls. Some don't, but some do. I prefer to do house calls on patients that are very frail, and it becomes a matter of, are we going to be able to keep this patient at home, or are we going to have to take them to a nursing facility? You know, if their care needs can be met at home, if a nurse can go in once a week and manage their medications, if I can go in once every 3 to 6 months and see them, if a home health aide can go in, physical therapy can go in, and we can keep that person at home for as long as possible, I think that improves the patient's quality of life as well. My mom, I think, has this gift of helping us realize what we need to do to better ourselves as human beings. She's a very compassionate person. She was a nurse, she's now retired, but she made sure that we were involved with the care of my grandfather who had dementia. And that meant when I was in high school, I would have to go home and make sure he had lunch, or when he was too ill and he was wandering around and he was in a nursing home, we took turns having dinner with him at nights, so he wasn't alone in the nursing home. Even helping with taking baths, even helping with other needs, other grooming needs, or just sitting and talking with him. And that really helped me realize we have a vulnerable population, but they need help. And this is a population that we can learn a lot from. These are important people. We have to care for each other. And I think this is an area that really needs more attention. And so that's why I went into geriatrics. I wanted to be a doctor to help people, and I think I can help people more in this area of medicine.